Have you ever had the flu? Did you ever get pink eye before? Did you know viruses and bacteria cause both of these? Both viruses and bacteria can spread to other people. Like with pink eye. You touch your infected eye, then you touch something or someone, and they touch their eye, and it spreads to them. Then they touch someone or something, and it spreads, and spreads, and spreads. Next thing you know, everyone's got it. STIs, STDs, HIV, and AIDS are also like that. Well, sort of. What's it all about? These infections and viruses come from one thing and one thing only: sexual intercourse. Every sexual partner you have is part of your sexual network. And if you have an STI, STD, HIV, or AIDS, every one of your partners is at risk.
What is an STI? Well, an STI is a sexually transmitted infection. Some people call them sexually transmitted diseases, or STDs, but doctors prefer the word infection because a person may be infected and may potentially infect others without showing signs of disease. So, we'll go with STI.
A surprising number of people have or have had an STI. As many as 1 in 4 teenagers have or have had an STI. That's 25%. It's dangerous to think that you can simply have any sexual partner you want without thinking. Remember, when you have sex with one person, you're also having sex with everyone they slept with. What can you do to try and prevent STIs? Simply practicing abstinence is the easiest way. Wait for the right person. Limit the number of sexual partners you have. If you can't practice abstinence, simply limiting the number of people you have sex with helps reduce your chance of picking up infections or disease. Use condoms correctly. A properly used condom helps prevent STDs and is always a good choice. Not having sex if you see a sore or pus. Simply refuse to engage in sex if you think your partner might have an STD or STI. There are many diseases and infections that are transmitted from sex. Some are caused by bacteria and can be cured, while others are viruses and have no cure. Let's take a look at some of the most common STDs. Pubic lice or crabs is a bit different from other STDs, but still very uncomfortable and avoidable. Pubic lice are insects found in the genital area of humans and are usually spread through sex. So let's check other. It can be cured through medication. Chlamydia is a bacteria which comes from sexual contact. The signs of chlamydia include a burning feeling when urinating and a white discharge from the penis or vagina. Medication can help with this infection. Genital herpes is a virus with no cure. The virus stays with you for your entire life with outbreaks from time to time. Sores and blisters around the mouth and genitals are a sign that you may have genital herpes. There's a lot that can be said about HPV. Simply put, this virus is a family of over 100 viruses, including those that cause warts and can lead to cancer. Currently there is no cure, yet there is a vaccine for both boys and girls. Gonorrhea is another bacterial infection. It causes a discharge from the genitals, pain when peeing, and itching. This STD is curable through medication. Syphilis is a sexually transmitted infection caused by a bacteria. This dangerous STD causes skin growths around the genitals, and you feel flu-like symptoms, weight loss and hair loss. Syphilis is treatable but should be treated early before permanent damage is done. Hepatitis B. This virus has many symptoms like stomach pain, fever, joint pain, vomiting, feeling weak and tired, and your skin and eyes turn yellow. It's no joke. This virus cannot be cured and can cause a lifetime of liver damage. Human immunodeficiency virus, or HIV, is just that, a virus, and a very dangerous one that destroys your immune system. Symptoms include those of various sicknesses, such as the flu or a cold, and can develop into rashes and sores in the nose, mouth, or genitalia. There is no cure. I'm sure that you've already heard about some of these diseases. Some, maybe not. That's okay. The problem is when you don't have the right information. Everyone should do their best to make sure they know everything they can about their bodies and health. Let's talk about some truth or false facts on STDs to try and refresh and clear up your mind. Think about these and try to see if you know before I answer. A person can always tell if he or she has an STD. False. People can and do have STDs without having any symptoms. Women often have STDs without symptoms because their reproductive organs are internal. But men infected with some diseases like chlamydia also may have no symptoms. People infected with HIV, the virus that causes AIDS, generally have no symptoms for some time, even years after infection. With the right medical treatment, all STDs except HIV can be cured. False. Herpes, an STD caused by a virus, cannot be cured at this present time. Condoms are the best way to protect from the spread of STDs. False. Abstinence from sexual intercourse is the best way to prevent the spread of STDs. Condoms are the next best thing, but only abstinence is 100% effective. Teenagers can receive testing and treatment for STDs without notifying their parents. True, you can be tested and treated for STDs without a parent's permission or notification. Many community health clinics provide STD tests and treatment at no cost or for a small fee to adolescents or other patients who cannot pay. It is possible to get some STDs from kissing. True, it is possible to be infected by syphilis through kissing if the infected person has small sores in or around the mouth. The herpes virus can also be spread by kissing if active sores are present. People usually know they have an STD within 2 to 5 days after being infected. False. Many people never have symptoms, and others may not have symptoms for weeks or years after being infected. HIV infection may not show symptoms for years, but the infected person is capable of infecting other partners during that time. A person with herpes can be completely cured with a proper medical treatment. False. Currently, there is no medical cure for herpes. Treatment is available for the symptoms, but there is no cure for the disease. How many did you get right? On top of all the risks involved with being sexually active, another life-changing effect is unplanned pregnancy. Pregnancy can and does change your life. It's at that time that you become responsible for another life outside of your own. Teens are too young to have the time, money, and responsibility to raise a child. Your teen years are for growing, playing, learning, and for simply just being young. No matter what you may think, all teens are faced with the opportunity to engage in sexual activity at some point, and it's at that time that you need to know what to say. Very simply, the only way to completely guarantee that you will not get pregnant or get an STD is through abstinence. Abstinence means the choice to not have sexual intercourse. Yes, it can be a hard decision to make, but thinking before making any decision is always the best choice. Remember that condoms are always the safest way to engage in sexual activity. So if you do have intercourse, remember to use them. They're easy to use and they're free from the dispensaries. That one decision to be involved sexually with someone could be the one decision that changes your life forever. STDs, AIDS, HIV, and unplanned pregnancy are not worth it.